Hello and welcome to Mental Health Matters. I'm Edgar Wiggins, your host for this program that is dedicated to providing you practical and useful information regarding mental health issues and needs. Psychiatry. What is it? What's a psychiatrist? Here to help us understand this very important subject is Dr. Mark Komrad. Dr. Komrad is a psychiatrist on the clinical and teaching staff of Sheppard Pratt Hospital and the Johns Hopkins Hospital in Baltimore. He is also a clinical assistant professor of psychiatry at the University of Maryland. And finally, Dr. Komrad is on the board of the Maryland Foundation for Psychiatry. Good morning and welcome to Mental Health Matters, Dr. Komrad.
Thank you so much for inviting me, Edgar.
Let's start out by talking about what a psychiatrist is. What is a psychiatrist and what is the field of psychiatry? What are we talking about here?
A very good question, because remarkably, although people hear this word often, they often don't know exactly what is a psychiatrist, and particularly what distinguishes us from other mental health professionals. Really, the easiest way to answer that question is to remind folks that a psychiatrist is a physician. A psychiatrist has gone to medical school like any other doctor and has specialized in problems of mental life. We have a special residency training, just like surgeons have their residency and pediatricians have their residency after medical school. We have our residency of 4 years in which we learn to master the problems, the ways in which things can go wrong in people's mental lives. Sometimes we even go on after that to even develop subspecialty interests like child psychiatry or geriatric psychiatry. So we are fully trained physicians, and as such we can do anything any doctor can do. We have some special things that we do that other physicians don't do. For example, spending lots of time sometimes having meetings with patients where we just talk, but in addition, unlike other mental health professionals who also can just talk, we can also provide other treatments such as medications, and even if necessary, treat people in an inpatient setting in a hospital and use some other special techniques. Perhaps we can get into some of those. But at the end of the day, we're just physicians, MDs, like your family doctor.
So what might be some of the advantages of seeing, say, a psychiatrist versus seeing a psychologist? Because my understanding is that, of course, psychologists do talk therapy or psychotherapy or counseling. But what might be an advantage of seeing a psychiatrist?
Well, one of the things that we learn is that problems in mental life can occur from a large variety of different causes. We generally divide those causes into sort of 4 areas. Some problems in mental life can best be understood as diseases, such as diabetes, for example, is a disease. There are certain mental conditions that could be understood as diseases, such as schizophrenia, for example, or bipolar disorder, manic depression, or even some kinds of depression. Other problems in mental life are due to how we vary as human beings along different dimensions, like some people are taller and some people are shorter. Same thing with the way we're made up. Some people have higher intelligence, some people lower intelligence, some people are more vulnerable or less vulnerable. Some problems are understood like that, for example, personality disorders. Some problems are due to learning and how in the course of our life we've learned to do things and been reinforced, or we've seen from our examples in society or are influenced to behave in certain ways. Some problems are best understood like that, for example, eating disorders or addictions. And then finally, there are problems that go wrong in people's mental lives due to the stories of our lives, how we were raised and what happened to us. So for example, let's say we were raised in an abusive family in which trust was difficult. We can understand how that story might lead, for example, to problems making commitments in relationships when we're more mature in adult life. So that's another domain of problems. Why do I mention these 4 domains? Because psychiatrists are really experts at trying to answer the question, what's going on here? And we are trained in all four domains: disease, dimensions, behaviors, and life stories, in order to make a comprehensive evaluation. And once making that comprehensive evaluation of all four areas, we are also in the position to treat any of those four areas. And then finally, it's important to say that there are some problems in mental life that seem to be due to other diseases. For example, a brain tumor, or a thyroid imbalance, or even certain kinds of cancer or AIDS can cause disruptions in the areas of thoughts, feelings, and behaviors, which is what we mean when we say mental life. And as physicians, we psychiatrists are in a good position to try to make sure we're not dealing with another disease, perhaps a disease that even hasn't even been diagnosed yet, like a thyroid problem or a brain tumor, or another kind of problem, which, based on our medical training, we're in a position to try to flesh out. So that kind of comprehensive, total view of all the different ways of thinking about what could be going on here, that really is the expertise of a psychiatrist, and that is something that we are trained to do more comprehensively, and we also are empowered to provide a wider variety of interventions based on that, the answer to what's going on here, than any other mental health professionals such as psychologists or social workers.
Well, what about some of the interventions? What might a psychiatrist do?
Well, let's think about these four areas that I mentioned. For example, those things that we think may be due to a medical illness, we may be in a position to order laboratory tests or possibly refer to another specialist once we've been able to clarify that that's the problem. Other things that may be due to chemical imbalances in the brain, also we understand as diseases. We have a wide variety now of state-of-the-art medications that are available to treat those things, and we as psychiatrists can personally provide prescriptions, and we are experts in those kinds of medicines. Some family physicians deal with certain kinds of medicines, like antidepressants, but it's something they do occasionally. We are experts in those medications, so going to see a psychiatrist instead of your family doctor for that is kind of like if you had a heart condition. You'd probably want to see a cardiologist who is an expert in those kinds of problems and the medications used for them, and have the support and the background of your family physician. So medicines is something that we can do a lot of. I do want to say that people commonly believe, because we are the only mental health professionals who can prescribe medicine, they sometimes mistakenly believe that's all we do, that we just prescribe medicine. And I want to just make it clear that we also talk to patients.
Well, one of the other things that often comes up is the whole issue of managed care. And their job, which is, among other things, to contain cost. And when we look at mental health professionals, one of the things that we know is that when you see a psychiatrist, that is the most expensive treatment. I often believe, and this is my small editorial comment, that often patients are getting shortchanged. Sometimes people just see psychiatrists for a consultation around medications, but I think it's really important, your message about the fact that psychiatrists really are experts and do see the patient as a total human being.
Right. And yes, managed care has tended to push us more into the role of being the diagnostician, the one who answers the question, as I said before, what's going on here? And then sometimes asks us, well, if it's just talk the person needs in order to overcome their problems, to refer them on to a psychologist or a social worker. But oftentimes we can just as easily do that talk therapy ourselves. Sometimes it's even particularly with more complicated cases, much more efficient and much more effective to combine the medication treatment and the talk therapy in one and the same place, something that I affectionately call one-stop shopping.
Sure.
And psychiatrists can offer that kind of one-stop shopping, which is especially good for more complicated cases. But even for simpler cases, sometimes being able to combine the two really doubles the power of healing so that you actually end up getting a more efficient treatment, so people can actually get better quickly. And perhaps not surprisingly, because of that increased efficiency in one-stop shopping, you actually end up spending less money on the mental health treatment in the long run than if you split it up.
Let's just kind of change direction a little bit, because certainly we have those issues, but I think there also are some common misperceptions about psychiatrists, what they do. Often we see roles perhaps in TV, in movies, in Hollywood. There are these kinds of ideas that psychiatrists are not really mental health professionals, but some kinds of often strange people. I mean, there are lots of things, Hannibal Lecter and some of the other characterizations.
And
that
Silence
we've
of
seen.
the Lambs.
Sure, sure. Can
Right.
you just comment on that? How accurate are the portrayals of psychiatrists that we typically see?
Well, you know, it depends on how far back you go or how recent you are. Hollywood tends to mirror what's going on in society in general. So back in the golden age of Hollywood, in the 50s and the 60s, the era of Alfred Hitchcock, for example, psychiatrists were often depicted as the wise people, almost like detectives who would go in and unravel all the mysteries, and often at the end of the movies would come out, like in the movie Psycho, will come out at the end and explain it all and explain what's going on. Well, in more contemporary times, as you mentioned managed care, for example, beginning to change and put pressure on psychiatrists to just do the diagnosis or just give medicine, Hollywood has also changed our depiction. And now what very often Hollywood has done with that is shown us to be not just the medication guys, but often the evil medication guys with these sharp, pointy needles, you know, who, and also taking from the fact that we can use the hospital, and sometimes if patients are dangerous, we can even put people in the hospital with legal due process against their will for a while until they get better. Hollywood loves that one too, and exaggerates us as prison guards and people who deprive everyone of their civil rights, often at the pointy end of the syringe, and show us sometimes to be scary, very powerful, and monstrous, such as in Silence of the Lambs. Alternatively,
Hold that thought, because this is something that we want to get into some more, but we need to take a break, and we'll be right back.
Did you know you can help keep Maryland safe? I'm Colonel Terrence B. Sheridan, Superintendent of the Maryland State Police. In cooperation with local, state, and federal law enforcement partners, we are working hard to identify and prevent acts of terrorism in Maryland before they occur. We need your help. Trust your instincts. If you see someone or something unusual that could be related to terrorism, pick up the phone and call. You can reach us around the clock at our Terrorism Tip Center at 1-800-492-TIPS. That's 1-800-492-TIPS. Don't hesitate, give us a call. Together, we can make Maryland's homeland secure.
Bachelor number 1, how would you advise me to structure my investment portfolio?
I would say be cautious and invest in government bonds, money markets, and CD accounts.
Bachelor number 2,
I'd say at your age to invest fully in high-yield stock.
and bachelor number 3.
I'd diversify your investments. It would make your overall portfolio more balanced and can minimize your risk.
Okay, there you go. Now it's time for you to make a date.
Bachelor number 3.
Bachelor number 3.
Remember, make a date today to diversify your portfolio and choose to save.
Welcome back to Mental